Welcome, Nay. Thank you so much for joining this day 4 for the whole team training for adult eating disorders. How are you doing today?
Yeah, I'm good, thank you.
And we've got the job today of talking about type 1 diabetes and eating disorders. And thank you just so much for sharing your story and being willing to talk about your own experience. I know the teams will really value it. So thank you so much. So to kind of give us a bit of background, can you tell us a bit about your journey leading up to getting to the compassion team?
Sure. So I was diagnosed with anorexia when I was 15 years old. I'm now nearly 34. And I had some inpatient treatments, and I was actually in recovery and doing really well. I just moved to a new place, a new city, and a couple months later I got diagnosed with type 1 diabetes. And my diagnosis was a bit crazy in that 4 days after leaving hospital, I went backpacking across South Africa, which was really fun, but a bit of a crazy thing to do straight after a type 1 diagnosis. But I remember being told I have to count carbohydrates and watch what you eat. And I was actually told a lot of things that aren't actually true, which I didn't know at the time, but was told like I can't eat donuts and I have to eat brown bread, not white bread, can only eat 10 grapes at a time, things like that. So I was told a lot of incorrect information, and yeah, was told to carb count. And of course, in eating disorder recovery, for me, this was just, it was awful. I didn't know how I was going to cope with it. Of all the things I could be diagnosed with, I was like, why does it have to be something about food? But I managed on fixed doses for a while, and yeah, I continued with my recovery. But then in my mid to late 20s, I actually developed diabetes burnout, and I had hidden my diabetes diagnosis for many years. I didn't tell my friends or my boyfriends or my boss. I was just really, I really was ashamed of it. The same with the anorexia diagnosis. I didn't tell anybody. And so when I moved cities again, I loved that I could just be me and not be the anorexic girl or the diabetic girl. So it made sense to me at the time. But yeah, when I developed diabetes burnout, and I was struggling to just do all the diabetes care, I got some help from my diabetes team, and they put me on a insulin pump just to get insulin into me, make it a lot easier, just press some buttons instead of taking injections. But with a pump, you have to do really careful carb counting. So I went on a education course, and after that, I really tried to count my carbs a bit more carefully, and that ended up becoming quite an obsession. And I was getting quite poorly just from insulin emission. I was losing weight, and of course, all my healthcare providers thought that it was anorexia, but for me, it wasn't. I didn't have body image distortion anymore, and I wasn't trying to lose weight. However, I just kept losing weight and controlling my eating to control my diabetes. So instead of taking insulin, I would skip carbs. And that became my way of life for quite a long time. And my weight was really dropping, and my diabetes team offered to get the eating disorder service involved, which for me was a big no, because I said, look, I don't have anorexia anymore. I'm not trying to lose weight. But I was struggling with coming out about my diabetes, and all the emotions of the diagnosis were coming to the surface that I had just shoved down for years. But we did get the team involved. Initially, it was a bit of a disaster when I first met the consultant psychiatrist, just because of the lack of experience of mental health team when it comes to type 1 diabetes. But we agreed that I would go into an eating disorder unit. And again, I was really reluctant, but I knew that I needed help, and I couldn't take my insulin reliably. So we agreed that I would go into an inpatient unit, and that's kind of how the compassion team came about. And yeah.
And I think there's only, a few of these pilot sites, aren't there, where eating disorder services and diabetes teams are working together. I think there's about 3 sites across the country. And I think from the world of eating disorders, and obviously from my own recovery, my strategy has always been to not look at numbers, not look at food, not look at, anything that would trigger me. But with this, you can't do that. And it blows my mind, because it's something you have to focus on every day. You have to look at numbers. And that just seems so challenging.
Yeah. Eating disorder recovery is the opposite to diabetes management. And that is where there is a constant struggle. Even when I'm recovered from anorexia and don't want to lose weight and don't have an issue with my body image, every single day, I am tempted to go back into eating disorder thoughts and behaviors because of the very nature of diabetes management. Yeah, as you say, all the counting and focus on numbers.
Yeah. Wow. And I think it's just really, whilst it sounds so hard, it's really helpful for us to understand that, just those challenges that are involved. What did the compassion team do in terms of treatment they offered? What was really good about it?
So every week in reviews on the unit, somebody from the diabetes team would come over and be part of it. And they were great at setting my doses and giving input in terms of insulin and treatment plans for hypos and what to do if there's ketones, all of those things that the eating disorder unit were clueless about. And as I transitioned back into the community, I would have more appointments at the diabetes centre, and the 2 teams communicated with each other. And there were a lot of difficult moments and hiccups along the way, but overall they did really well. But I think also because I so badly wanted to recover from, diabetes burnout and insulin omission and an obsession of healthy eating, I'd say is orthorexia, which also isn't really a proper name, but I really wanted to recover from those. So I was willing to work with both teams.
And I think you were very gracious, May, because you were one of their first patients, I think, weren't you? Very gracious in approach to them. I mean, when it came to kind of the eating disorder team, what did they use any language that was quite unhelpful for your diabetes? Because I'm just thinking of some of the team members sat here thinking, oh, what should I say to someone with diabetes? Could you give us some kind of tips on language maybe not to use or how to rephrase things?
Yeah, for sure. So the kind of things that you experience every day with anyone who doesn't understand diabetes is things like the label of like diabetic, or, oh, can you eat that? Or my grandma had diabetes, or my great uncle lost both his legs, really unhelpful things like that. And asking, oh, have you had it since birth? And will you die earlier? All those things are really unhelpful. But yes, on the unit, things like, oh, just take your insulin. That's like saying to someone with an eating disorder, just eat. It's not that simple. Or things like, it will only hurt for a second, or it will just take a minute. But actually insulin lasts for 4 hours, and long-acting insulin lasts for 24 hours. So the threat of hypos is constant. And little things in terms of, did you take your insulin? You could say yes if you've taken half a unit of insulin rather than 10, 15, whatever it is that you need. So I think being specific when it comes to asking about someone's diabetes management is really key.
That's so helpful.
Yeah.
And I think, we've talked in the past, haven't we, about kind of how even, diabetes is talked about. To me, when you've talked to me, some health professionals can talk about good and bad, a bit like we can talk about eating as good and bad. To me, it seems like that can translate across to diabetes.
Absolutely. Yeah, that's a massive one. So good blood sugars, bad blood sugars, or good graphs. So looking at my glucose graphs, people say, oh, that's a good day. But for me, it was actually a really bad day because I was avoiding carbs and avoiding insulin, which is why my blood sugars were nice and flat and not all erratic. And so congratulating someone on their good graphs when it's actually a really bad day, that's actually quite damaging, because you get the reward of the praise and the reward of the, great graphs and great numbers, but actually you're really struggling. So yeah, that's a really important one, good and bad. Yeah.
Just occurred to me as we were talking. And I mean, you've mentioned in this talk, Nate, diabetes burnout, and I'm so used to that phrase now because I've got to know you really well. But this phrase diabulimia is bandied around in media between health professionals. Can you tell me why you feel like diabulimia might not be the right phrase, and why you use that kind of diabetes burnout phrase?
Yeah, I think diabulimia can be misinterpreted. Whereas somebody with type 1 and an eating disorder, it can be a big range of things. Somebody might be omitting their insulin because they want to lose weight. Some people, it could be because they have a binge and then don't want to gain weight from that. It might not be all the time. Other people might just be exhausted from, the constant mental drain of having type 1 and just are neglecting their diabetes care because they haven't processed it properly, or because of their emotions. For some people, it might actually even be self-harm, insulin omission, or diabetes care neglect. So I think understanding the root of someone's reasons for insulin omission, I think that's really key. But I think a more general term that we use is TIDE, T1DE, type 1 diabetes and eating disorders. So yeah, that's what we use.
Yeah, and obviously diabulimia is not in any kind of diagnostic manual, so it's kind of just been this phrase that's been created, hasn't it?
Yeah.
I mean, in terms of eating disorder treatment, you've mentioned a few things already. Can you think of any of the other adaptations that you think might be helpful for people who've got type 1 and eating disorders?
I think at the beginning it's particularly important to talk to the person with diabetes about the symptoms and effects of reintroduction of insulin. Nobody talked to me about that, and it can be initially terrifying when somebody starts on insulin therapy again, and then they get a lot of edema, and their weight can, shoot up, and they can literally just go quite puffy from all the water retention, and that's horrible if you've got well, it's horrible for anyone, but if you've got issues with weight and shape and body image, that really needs to be talked about. And better communication between the two teams with the mental health and the diabetes, because I know when I was in treatment, the two different systems that the hospitals used couldn't share with each other, so there was a lot of mixed messages and things not communicated. So I think that's really important. And things like make sure you search people's bags and make sure they haven't got carbs in their room, and use fresh insulin and diabetes supplies. Don't use the patients that they bring in, because I used my insulin and it was out of date, and it spoiled, and so obviously it wasn't effective, but people didn't know that on the eating disorder unit. And I'd say follow up with patients when they've left the eating disorder unit just for leave, or just for a day out or something, and ask them direct questions. Did you tamper with your insulin? How many units did you take? Things like that.